It's been a little while since we've talked about bladder issues, and this is such a huge thing for women, not only menopausal women, but any of us, especially after childbirth, that I think it's worth talking about again. And today I especially want to talk about non-surgical ways to treat this, because for sure, surgery is an option, but there are non-surgical ways that can be really helpful. And if we can avoid surgery, that's always great, in my opinion. So starting at the lowest level of things that you can even do at home by yourself, we start by just generating force with those muscles ourselves. So most of us have done what we call Kegel exercises, which is voluntarily tightening those muscles. And just like lifting weights anywhere, we can help create a more supportive bottom and top. We can actually contract the muscles throughout the pelvic floor to help support the bladder, as well as help support the rectum and give a little bit more tone with intercourse. So all of those good things. But Kegel exercises are hard to do. It's really difficult to do enough of them to make a difference. And frankly, if there's actually a gap in those muscles, it's very difficult to do those exercises at all. But starting with pelvic physical therapy, you can see a pelvic physical therapist. I've actually done that myself. She can assess what's going on with your muscles and then set up a program for you to get on, and that's a great idea. So we'll put that on the list. If you come to see us in the office, we teach you how to do Kegels. We kind of do a version of a pelvic PT visit and set up a program to see if that will help. And you can also use electrical stimulation to do those Kegel exercises for you. So I am a huge fan of this technology since I had it done myself. It's called the Emsella chair. Emsella. So the Emsella chair I'll show you later on in the video is a device that you sit on, and it actually does those Kegel exercises for you. You can do way more than you could possibly do on your own because your muscles don't reach fatigue. So electrical stimulation of muscles is a really great way to get your pelvic PT in, and it does work better than doing them on your own because frankly, you could never do that many. So that's one option, some form of pelvic physical therapy, whether you're doing it yourself or using electrical stimulation. And then we can also do various things to increase the collagen on the anterior vaginal wall. There are even products, now I don't actually use these because anytime you're injecting foreign substances, there are a variety of risks that we start getting into, but you can have different substances injected into the anterior vaginal wall to give it more strength. That's an option. Now we also can do laser, which creates more collagen, as well as using platelet-rich plasma. So we talked a little bit about that last time in the video about vaginal dryness and pain. So vaginal laser actually has this side effect, even though it's designed for improving moisture, it actually can also improve bladder health, which is kind of a cool side effect. So don't forget about that option. And then, of course, last, we're talking about surgery, some kind of surgery to support that anterior vaginal wall with or without mesh. So those are broadly the treatments that we're looking at when somebody's complaining of stress incontinence. And then also weight loss, of course, just generally being fit, using your muscles throughout your body, all of those things help. But absolutely, I would not be in the camp that just says, well, that's just a normal thing that happens with age or childbirth and put up with it. How about don't put up with it? It's not going to get better with age if you don't do something to correct it. The younger that you are, the better, because our muscles are stronger.